Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, board certified rheumatologist and obesity medicine specialist. Today, I want to share an incredible success story with you about one of my patients. He is a 50-year-old male with history of severe obesity. We are talking about obesity with a BMI of 55. Now, he has made an amazing transformation with the help of the medication, but it always includes lifestyle, better and wiser choices about your food. So, listen to this story. This patient started Zepbound with me actually February of this year. So, it's not been even 1 year. He has reversed not only his weight problem, he has lost 70 pounds. He's still on a higher BMI than an average person. Remember, he started at a BMI of 55. He's down to 44 BMI. We still have long ways to go, but what reality is, he has already reversed two of his chronic medical conditions. He has reversed his hypertension. He was on three hypertensive medications, and two of them are gone. He's only on one hypertensive medicine, which I think over next 6 months he will be able to take him off of it. But interesting enough, his ED, the erectile dysfunction, has gone so much better because as you lose adiposity, the visceral fat, your testosterone, which is bound to the proteins and not free to actually help increase libido and erections, has also reversed. So now he's back in his game. His wife is happy. He's happy. He's not even using his medication. So let's see how we got here. So my patient with a BMI of 55, which is category of severe obesity, after starting on Zepbound, which is a cutting edge medication for weight loss. It's a GLP and GLP-1 and GIP analog peptide. It has two medications on it. It is one of the best medications currently on the market to reverse obesity. And I use it whenever I can for my patients, barring any contraindications. So his astonishing 70-pound weight loss is more than just a number. His life has gone back. He is feeling tremendously better in terms of his mental health, his physical health, and his confidence. So previously uncontrolled hypertension is controlled. Previously addressed or unresolving erectile dysfunction is now better. He is back in his game. So what how Zepbound works? Well, Zepbound is a class of medication that regulates our appetite and increases our body's sensitivity to insulin. For my patient, this meant reduced hunger. This meant boosting fat loss and visceral fat. He's lost a lot of his waist. And in addition to this, what we have found out after our discussions between me and this patient is if we stay on each dose of the Zepbound longer than what the company recommends, it makes more improvement in your weight loss journey. And how it is, and I'm going to explain to you. When you start losing weight, your brain thinks that you had, let's say this patient had a weight of about 415 as a starting weight. Now, the first 1 month, he drops maybe 15 pounds, 10 pounds. If I stop the medicine, his brain thinks his weight should be 415. It rebounds. But if I give him time to stay on that weight range of maybe 10 to 15 pound less and give it a little bit more time with the medication, keep the weight steady, the reset in the brain, in the body physiologically happens, and the chances of you going rebounding is much less. Also, you have to understand that if we give body the chance to actually adjust to the medication, it actually regulates our gut motility better. The side effects of the GI system are much less in those patients. I've also noticed that I have actually time to make sure that they are building their muscle. Muscle loss is a problem with these medications. Sarcopenia can happen, and that could happen with anyone who loses weight. even if you did not use the medication and you lost weight, you will be losing muscle. It is not that the medicine is causing the muscle loss, it's part of the process. But if we slow down the weight loss and we ask patients to go ahead and start with some strength training, you will slow that down. And that would happen if you increase your protein intake about 1.2 to 1.5 grams per kg body weight of protein intake divided over 3 to 5 times a day. It could be in the form of whey protein, it could be meat, it could be your nuts, it could be in the form of plant-based proteins. Mix it up. And this patient did that. He continued to work on it. So what I'm trying to get the point across today is to make sure that if you are on the weight loss medications, don't rush the process. Take time, get your mind and body adjusted to the new weight, so that if you were to stop the medicine, you won't rebound. Now, the other important part that I want to tell you is that sometimes we do have to talk to the insurance companies and maybe write in a letter of medical necessity stating that we don't want to increase the medicine too quickly. I've had some patients whose insurance company would keep telling me that I need to keep increasing the medicine at a pace that the FDA approved it for, because I want to say they want the patients to get over up to the maximum dose quick enough and then get off of the medication. But right now, we are getting good signals about the medication. We are not seeing patients having any major side effects. Why should we take off of it until we have ensured that this is your now reset for your weight loss, that you will not regain the weight, and we have the time to taper off the medication slowly, but keeping it on? Because I've clinical studies I've seen, and in real life I've seen patients who are unable to keep up with their diet commitment and their exercise because they never formed the habit of doing it in their lives, that they regain the weight. But my process is I'm going to take it slow to go all the way at the top, and I'm going to gradually come down so that you can readjust your lifestyle for the new weight, for the exercises that you want to do. Now, another important point that I want to raise today, my patient is going for a thyroid surgery, a neck gland. He has an issue there, and that's going to be operated on. And after discussion with his surgeons and with him, we have decided that we will take him off of the medicine 2 weeks prior to surgery. Why? We know that the medication works on gastroparesis, or it causes or induces gastroparesis, meaning it decreases the gut motility. And if you're going under anesthesia, you need to make sure the medicine is not in your system, in your intestines, because it increases the risk of aspiration, pneumonia. Aspiration is when you are under sedation, the food contents or the gut motility is so slow that if you eat something, you could aspirate. It is unlikely to happen, but with the abundance of care and precaution, we want to make sure that not happen. But I am sure that this patient would not regain his weight. Now, his strategy was, we started his Zepbound with 2.5 milligram dose. I kept him on for 3 months. That was the weight he lost, the maximum weight. For 3 months, he constantly lost about 30 pounds on one dose. After that, we went on 5 milligram dose. We stayed on 3 months. Then 7.5 milligram dose, we stayed on 3 months. And 10 milligrams, he completed 3 months, and now I just started another 3 month round. He'll be on 10 milligram for 6 months. So this is what I want to bring the point across, that with our clinical practice, we are learning how to work with medicine with individual patients. And I would suggest that if you are planning to do that, talk to your doctors about it, and the benefits of obtaining a slow and steady weight loss is better than trying to rush it through. Think of it as a marathon and not a 100-meter race. Until then, take care of yourself. I'll see you guys again in the next video.